just another normal night. You take one bite, swallow too quickly, and then suddenly something is wrong. The food doesn't go down, it doesn't come back up. You try to clear your throat, nothing. You try to cough, still nothing useful. Then your chest tightens, your eyes water, and in one terrifying instant, your body realizes the truth before your mind can fully process it. You are choking, and there is nobody there to help you. Now, let me tell you something as clearly as I can. In a real choking emergency, the first 20 seconds are often the difference between a frightening close call and a fatal delay. Not because you're weak, not because you're old, but because panic steals time, and choking is one of the few emergencies where time disappears faster than people expect. And if you're over 60, the danger is even more serious. As we age, swallowing often becomes less efficient. Throat muscles may not coordinate the way they used to. Dry mouth from medications becomes more common. Dentures can affect chewing, and underlying conditions can quietly increase the risk of food entering the airway instead of the esophagus. That means this is not some random what-if scenario. This is a very real emergency older adults need to be prepared for. I'm Dr. Robert Harrison, and if you're over 60, this may be one of the most important emergency survival videos you ever watch. Because today, I'm going to walk you through the 7 most important things to do if you start choking while you're alone, ranked from helpful to potentially life-saving. And I need you to stay with me all the way to the end, because the final steps are the ones people usually don't know, and they are often the difference between helpless panic and self-rescue. So let's start with number 7, and this one may save your life precisely because it sounds too simple. Number 7, don't waste your first seconds asking, "How bad is this?" Ask one question: can I still move air? When choking first begins, most people lose precious seconds doing the wrong kind of thinking. They stand there confused, they swallow again, they reach for a drink, they try to wait it out. But in those first few moments, you do not need a perfect diagnosis. You need one answer: can I still move air? That is the first decision point. If you can still cough strongly, make noise, or pull in even some meaningful air, that usually means your airway is partially blocked, not fully sealed. That is still dangerous, but it also means your body still has one powerful weapon on its side: your cough reflex. And in emergency medicine, that matters. Because the body's natural cough is often the very first and best chance to clear an obstruction before things become critical. But the danger is this: a lot of people interrupt that natural rescue response by panicking into the wrong actions. They gulp water. They try to swallow harder. They stick fingers into their mouth even though they can't see the object. They start pacing around in fear instead of acting with purpose. So if you can still move air, even if it feels frightening, your first job is not to panic. Your first job is to recognize, I still have a window. I still have a chance to clear this. That brings us to number 6, and this is where a lot of people accidentally make the emergency worse. If you can still cough, do not stop coughing, but cough correctly. If you can cough, that is good news, not comfortable news, not reassuring news, but good news, because it means your body is still trying to save you. But here's the problem. When people panic, they often cough the wrong way. They do short, weak little throat coughs, tiny, frantic bursts. The kind of cough that sounds active but doesn't actually create enough force to move a blockage from the airway. What you need is not a nervous throat cough. What you need is a deep, forceful, explosive cough. Stay upright, brace yourself, take in whatever small amount of air you still can, and then cough from your chest and abdomen hard, deliberately, and repeatedly. Think of it like trying to blast the obstruction out with pressure from below, because that is exactly what your body is trying to do. This is not the moment to be polite. This is not the moment to try to stay composed. This is not the moment to quietly clear your throat and hope for the best. This is the moment to become aggressive with your cough if air is still moving. And I want to say something directly to my older viewers here, because this matters. Many people over 60 have been conditioned to minimize distress, to avoid making a scene, to tell themselves, I'm probably fine. But if you are choking, this is not the moment to stay dignified. This is the moment to stay alive. Because if your cough suddenly gets quieter, weaker, or turns into that horrifying silent struggle, then the emergency has changed. And once that happens, you do not hesitate. You move immediately to number 5. The second you realize it's severe, stop experimenting and switch into emergency mode. There is a very dangerous moment in choking where denial becomes deadly. It's the moment where you stop being someone who swallowed wrong and become someone with a blocked airway. That shift can happen fast. 1 second you're coughing, the next, your throat locks, your cough weakens, you can't speak, and you can't pull in enough air to do anything useful. If you lose those seconds to disbelief, you may not get them back. This is where a lot of people freeze because they're waiting for certainty. They want to know for sure that it's serious enough before they act. But in emergencies, waiting for certainty is often how people lose their window to survive. If you cannot speak, cannot breathe effectively, or cannot cough forcefully, you need to mentally flip one switch immediately. This is an emergency. I act now, not after one more swallow, not after you look in the mirror, not after you try to walk it off. Now. And this mental shift matters even more if you are alone, because there is no one else in the room to identify the emergency for you. In that moment, you are the rescuer. And that strategy begins with number 4. Perform self-abdominal thrusts immediately and do them with real force. This is the point where your body may no longer be able to clear the blockage naturally. When that happens, you need to manually create the same kind of upward pressure another person would use if they were helping you. Make a fist. Place the thumb side of that fist just above your belly button and below your breastbone, not on your ribs, not too high into your chest, not too low. Then wrap your other hand around that fist and thrust inward and upward sharply. Think in and up. You are trying to create a sudden pressure burst under the diaphragm. And here's where people fail. They do it once and stop. No. If the first thrust doesn't work, do it again, and again, and again. Hard, fast, committed. Because this is not a comfort move. This is not a gentle first aid gesture. This is a rescue maneuver. It may hurt, it may bruise, it may feel violent. That does not mean you're doing it wrong. In a true airway emergency, the question is not, could this leave a sore spot tomorrow? The question is, can I get air back before I collapse? And if you're over 60, do not assume you're too old, too fragile, or too weak to do this. Survival is not graceful. It is effective. But there's one thing many people are never taught, and it becomes critical when your hands are not enough. That brings us to number 3. Use a hard edge, because your environment can become your rescue tool. If your hands are not creating enough force, your surroundings can. And this may be one of the most important self-rescue techniques older adults ever learn. A hard, fixed surface can often generate more effective pressure than your arms alone, especially if you are already getting weaker, more panicked, or more lightheaded. Find a firm edge, a sturdy chair back, the edge of a solid table, or a countertop corner. Anything hard, stable, and fixed. Then place the upper part of your abdomen, the same spot just above the belly button and below the breastbone, against that edge, and drive your body forward and down sharply and forcefully. What you are doing here is using that edge to create the same inward and upward pressure another person might create if they were performing abdominal thrusts on you. And yes, it may look violent. That's fine, because choking is violent. This is not the time to worry about bruising your stomach or knocking over a chair. The only thing that matters is whether this creates enough force to move the obstruction before oxygen runs out. If it doesn't work the first time, do it again. Fast, hard, deliberate. But now we need to talk about the part people almost always underestimate. Even if you are doing everything right, you may still be running out of time. That brings us to number 2. Activate emergency help early, because your biggest enemy is not the food, it's time. Sometimes a person can do the right things and still need help. Maybe the object is tightly wedged. Maybe your airway is nearly sealed. Maybe your strength is fading faster than you expected. Maybe you are becoming dizzy and disoriented. That is why one of the smartest things you can do if you are alone and choking is to activate emergency help early, not after you're collapsing. And no, this does not mean sitting down and calmly explaining your symptoms while you can barely breathe. It means doing one thing: call emergency services and put the phone on speaker, even if you can't say much, even if you can't say anything. Even if all you manage is a connected line and distress sounds, that still matters. Dispatchers are trained to respond to distress calls, including silent or interrupted ones. A lot of people hesitate because they don't want to overreact. They think, what if this clears and I feel foolish? But embarrassment is recoverable. Oxygen loss is not. If you have enough ability to trigger help, do it early. Wise survival is not about pride. It's about stacking the odds in your favor. And now we come to number 1, the part no one wants to think about, but everyone needs to understand. If the obstruction does not come out and your body starts to fade, what happens next may still matter enormously. If a severe airway blockage is not relieved, a person may eventually lose consciousness. Once that happens, the emergency changes completely. At that point, this is no longer just a choking episode. This becomes a collapse emergency, where chest compressions by rescuers may help move the obstruction and preserve circulation until advanced help arrives. If you are still awake and able to act, your job is to keep fighting with coughs, thrusts, hard edge pressure, and emergency activation. But if you are becoming weak, dizzy, blacking out, or losing control of your body, then the smartest thing you can do in those final conscious moments is to make rescue possible. Get low if you feel yourself fading. Do not stay standing if you are about to collapse hard. If you can, get to the floor in a controlled way rather than dropping violently. If your phone is nearby and connected, leave it. If your front door is unlocked, good. If not, don't burn your final seconds trying to create a perfect rescue setup. Focus on what matters most. The goal is not to be fearless. The goal is to be prepared enough that fear does not waste your time. Because choking is one of the few emergencies where a person can be perfectly fine 1 second and in a full survival fight the next. That is why what you do in the first 20 seconds matters so much more than what you know in theory. You do not need a medical degree, and that's what I want this video to leave you with, not just fear, but power. Because yes, choking alone after 60 is terrifying. It is fast, it is quiet, it is one of those emergencies people never think will happen to them until it does. But now it is no longer unknown to you. Now, if it ever happens, your mind has something to hold on to, not confusion, not blind panic, a plan. And in emergencies, a plan is often what gives the body a chance to survive. So if this video helped you, do something important with it. Don't just watch it and move on. Save it. Send it to your spouse. Send it to your parents. Send it to the person who eats alone. Send it to the person who always says, that would never happen to me, because that is exactly the kind of lie emergencies love most. And if you remember only one sentence from this entire video, let it be this: when choking happens,